Hello. So we're going to be going over a specific client for a case and going over some options for assessment for that client. So the client we're choosing to discuss is a 10-year-old male diagnosed with autism spectrum disorder. This client uses full sentences to communicate with adults and peers. Those sentences include many grammatical errors, including prepositions, pronouns, and abstract concepts that make his communication a little difficult to understand. The client engages in a lot of self-stimulatory behavior, including hand flapping, vocal stim, but this behavior can be controlled by the client during table work and in natural settings when he is reminded to control his volume. Many of the client's deficits are in social and abstract concepts like eye contact, appropriate volume, continuing conversation. Due to his age level and level of communication and cognition, which is just understanding through thought and experiences, um, we need to progress his advanced skills that will be helpful for him to obtain gainful employment or further independence. He's in need of intervention of abstract concepts, reading comprehension, and become less rote or memorized. We're looking not to be in school, but to again grow in the clinical setting, group home, or vocational setting. So now we're going to go over some assessments.
Okay, we will also start with discussing the VB map. The VB map covers ages 0 to 48 months. It works with skills in verbal language, focusing on effective language and social skills. The skills assessed include verbal behavior milestones, such as requesting items or labeling items, as well as playing with peers. And then the VB map is directly measured and indirectly measured.
For the data collection procedures, the VB map uses my own master scoring forms. The first assessment is the milestone assessment, and that focuses on specific milestones and various goals associated with each milestone. The other assessments are the VB map task analysis and skills tracking, the VB map transition assessment, and the VB map barriers assessment. The validity and the reliability, the results are only meaningful if it's conducted by a skilled professional. It does require that the administrators be familiar with verbal behavior and basic behavior analysis and the awareness of functional relationships of verbal behavior and the speaker's environment. The usefulness in determining the intervention, the VB map will direct the order of which skills to teach. So based on the assessment, it'll determine how skills are taught.
The second assessment we chose to look at is PEAK, and PEAK is actually the assessment that we chose to use working with this client because we feel like it'll fit him best. For PEAK, the age ranges from 18 months into the teenage years and is typically used with younger learners. Our client is 10, so we think he is well within the range, the age range of PEAK working well for him. The skills range are foundational skills for both language and cognition through skills related to abstract abilities. I mean, this is everything from learning how to request for things, ask for things, and label things. The skills that are assessed in PEAK, there are over 180 programs, and some examples include things like eye contact, motor imitation, advanced language, and advanced learning skills. With this client, it's been stated that he struggles with those advanced language skills like prepositions, pronouns, grammar, and being able to like continue a conversation. And so the skills that PEAK goes over and teaches would just be amazing for him in helping develop those skills.
And so PEAK is a direct measurement. So this means that we would be observing the client, and this would be beneficial with this client particularly as he is in a group or vocational setting. So these skills could be directly measured. And it is simple to collect the data by using the direct module training assessment tool. And this allows us to either check yes, no, or unknown regarding the individual's ability to complete each of the items on these assessments. And the assessment score is then calculated, and this will then guide programming. And this has been known to be valid and reliable. And this would also be beneficial for the client because he has a BCBA assigned on his case. So he or she would then be able to directly observe that as well. And this is a very useful intervention as it will aid in the direction of which skills to teach, which creates a very individualized intervention based specifically on what each individual client needs.
So without formally assessing the client, it's evident that he would probably master out most, if not all, of the goals in the VB map without intervention, and PEAK would be the best fit assessment for that client. Thank you.